as part of your humility practices, that's some of that is trust and delegation to those around you. How do you, as somebody who, again, you carry a medical license, you carry liability responsibility for that patient that's asleep on your table, how do you go about with the process of opening yourself up to trust the people around you and to delegate to some of those people? Some of that trust is you're there, you're directly supervising, you're 100% involved. But in order to be the best at your practice, sometimes that means stepping back and delegating it to somebody that you trust. How has that process looked for you?
So, I would say one of my bigger weaknesses is trying to micromanage and trying to do everything. And the reality is that sometimes you can delegate things to people who do it a heck of a lot better than you do, right? And so whether that's in the clinic or that's in business, and so being able to do that and being able to find people's strengths and being able to find and recognize your own weaknesses is really, really strong. I think in the operating room for me, it really had to do with establishing trust and establishing that presence, as being there, but being able to let go of the suture needle and say, hey, you've seen us close this multiple times. Now you do it. And then moving forward from there. Are you looking back and understanding these are the instruments that are coming, these are the steps that are coming? Because once your team is so good, the OR is almost like a dance. It moves, and you've been there when it's moving and everything is humming and everything is there's not even hardly any words being spoken, and the case is just moving just in such a beautiful way. I mean, it's really is a cool thing to be in an operating room where everybody is on the same page and everybody's moving. And I think that then you get that opportunity to delegate, and you can delegate things like patient care, patient decision-making. And all of that has to do with trust. It also has to do with understanding that sometimes people will make a mistake. And when people make a mistake, there's two different ways you can handle it. You can use it to learn, or you can use it to, degrade people and make them feel terrible, right? And that's ultimately not going to do anything for you. It's not going to help you get where you need to be. And so if you can learn from those mistakes, recognize that they're there. I mean, one of the most powerful things this is going to sound a bit arrogant, from one of my mentors, and he knows who he is. He said, there's nothing that you can screw up in this operating room that I can't fix. And that's a level of confidence in the room for everybody else, who they can look and say, hey, this fourth-year resident, he's good because the doc is behind him and ready to fix it if anything goes wrong.
Well, and what that tells me about that attending and that doctor is that he is confident he can fix everything because he's had to do it before, either by somebody else or his own mistake. Right. And again, having that as part of your humility practice of saying that you can trust somebody, and you trust that even if I am not perfect, that we're all human. To be human is to err. And that's why we have a system of checks and balances in place that makes sure that patient care doesn't suffer as a result of human error. As a matter of fact, I think that the way that we collaborate, it helps each other a lot, right? There's sometimes things that I'll hear or catch that weren't part of what was presented to you that changes our treatment plan for a patient.
No doubt.
And vice versa. That's something that you have more experience with that I don't. I mean, I tell patients every time in the clinic when I see them, like, hey, I know you're seeing me today, but FYI, Dr. Piefer and I, we're a team. So every x-ray I look at, every MRI review, all that stuff, we talk about that. We go over it at the end of the day. And, if there's something that I missed, or something that we want to change our direction on, I have the humility to be okay with being wrong, right? And you have the confidence to tell me and not be afraid you're going to hurt my feelings, because we've established trust.
Right.
I know that any critique you give me is not on me as a person. This is something we're learning. This is something you're going to be a better, PA for, because we know this now, like we've taught this. So that's awesome.
And ultimately the patients will do better, right? Ultimately the reason we're here, which is to make people better, they're going to get better because we trust each other and work together. And so, and I think from both the surgeon and as a surgeon and as a leader, being humble in those moments and understand and being able to delegate things that, whether it's organizational, whether it's planning, whether it's whether it's in the operating room. I mean, there are so many different levels that you can delegate, that you can help make things better. Now, obviously, you can't just walk out of an operating room, but but you've got to do the surgery if you're the surgeon. But
Right, for sure.